Welcome to the Joe Cohen Show. Join me as I share my experience with biohacking and invite top health experts to explore the latest technology, supplements, research, and resources for optimizing your body and brain. Hey everyone, I'm here with Dr. Greg Nacarelli. He brings extensive natural medicine experience and has a strong background in genetics. He's passionate about helping people achieve optimal health by understanding the impact of the environment, lifestyle, diet, and genetics on health. He is a licensed naturopathic doctor and certified nutritional genomics specialist. He's currently pursuing his PhD in genomics from Clemson University. He obtained a doctoral degree in naturopathic medicine from Bastyr University, a master's degree in individualized genomics and health from Johns Hopkins University, and a master's degree in molecular biology from Lehigh University. He is a member of Phi Kappa Phi, or Phi Kappa Phi, National Honor Society. His previous research background includes RNA editing, vaccine and analytics, and molecular aging analysis. His current research interests include understanding the relationship between diet, lifestyle, genetics, and cardiovascular disease. Basically, you've been in school for a really long time.
Yeah, very long time. Let's see, probably in college, probably 16 years, 17 years. Too long.
Right. In
I'll be hopefully.
college, you got a master's, two master's degrees during that time, and then also a natural medicines degree, and now you're about to complete your PhD.
Yep, second doctoral degree. So and I'll hopefully be done that next year. So fingers crossed.
Okay. And the other thing, the other credential you can say you have is you work for SelfDecode.
That's a bit. Yes, we should disclose that. So, yeah, I think it will be 3 years in November. Been working for
Yeah,
SelfDecode.
awesome. And you're you're mainly working with doing health coaching with clients in SelfDecode, and and so I think you're a good candidate for that because obviously you know the genetics, diet, lifestyle, supplements, all that stuff, and you're able to bring it together. It's hard for us to bring on a lot of people there because it does require a lot of different kinds of expertise. And you also been you've been instrumental in creating our course. You want to talk
Absolutely.
a little Yeah, you want to talk a little bit of just about the course?
Yeah, sure. And just to echo those sentiments, there is so much information out there, and it's easy for people to get confused, especially when it comes to precision health, nutrigenomics, integrated medicine in general. We're getting more standardized with it, but it used to be not as standardized. And so, yes, SelfDecode is a platform, tries to simplify for people. And then the practitioner webinars try to help introduce. So there's two sets. There's the Precision Health Practitioner webinar series. This is more the theory component of things. So we talked about uh, fundamental genomics concepts, fundamental ethics concepts, nutrition, lifestyle, environmental health. We cover biometrics, microbiome, nutrigenomics. And so we lay down the foundation for those principles. And then we also have case study webinars that we have. We have 5 currently. We have one on gut health and thyroid. We have another one on cardiovascular health, another one on stress, and maybe more in the future. So yeah, lots of content. The first set of ones, Precision Health Practitioners, those are CE accredited. In order to do that, we could not do any marketing or advertising. So there's nothing SelfDecode specific on those. Those are CE accredited for naturopaths and genetic counselors, and for other health professions that are wondering, what could I use these credits? What you would basically do is take the information from the training, or ask your CE credentialing body and ask them, would you accept these credits? And in many cases they would, because they meet all the criteria. Like I said, no advertising or whatnot. The other set of webinars, the case study series, are using SelfDecode. So this is basically you're using SelfDecode. How do I work through a case? We include disease background information, and so one of the things is on diabetes. So we look at the pathophysiology of diabetes. What are the signs and symptoms of diabetes? What are typical genetics that you would contemplate? and then we run through a case. And so we have a case scenario of somebody with basically a full health pack workup, and then we use SelfDecode to figure out what genetic reports do we look at, what genes do we focus on, what recommendations do we make, and how do we use SelfDecode for doing this. So that's what
Okay.
you get.
Awesome. And yeah, so they get credits if they do the other course. And which you said those credits also extend to other. It's not only if to be a genetics counselor; it also extends to other
Yeah. So, for
professions.
example, somebody could be maybe a personal trainer, right? Or they could be some other type of um, nutritionist or something. So just because we have not, in order to get CE credits, you have to pick a certifying body. So three people help make this. So myself, naturopathic doctor, we have a genetic counselor, Lauren Morse, and then we have a nutritionist, Val Priscario. So Lauren helped get the CEs for genetic counselors. I got the CEs for naturopathic doctors. But it doesn't mean that if you're another profession, um, that you wouldn't be able to get credits. You just have to ask them ahead of
Mm,
time. So it's already pre-approved for those two professions, but to get it for the other ones, just I don't want people to run into the scenario where you do the training and then you submit it to your, to get CE credits. Because the idea with the CEs is you have a particular health profession. Like for example, we had a pharmacist reach out, right? So you're a pharmacist, you're interested in doing this, to the whatever pharmacy accrediting association, in order to approve that, they have to look at it ahead of time. So that pharmacist would send that information to whatever pharmacy CE certifying body and say, hey, I want to do this training, would it count? Usually there's degrees of credits. There's like more stringent ones, and then there's a certain amount of CE units. By the way, CE is continuing education. So there's a certain amount of continuing education units that aren't as serious. I'm willing to bet that this training would qualify for that. So, and hey, it's great information regardless if you get the CEs, but the CEs would be nice because we all have to do it. I got mine coming up next year. So I got to find things to get CE approved. But
awesome. Yeah, and so I guess if anybody gets CE credits for a specific discipline, we can talk about giving the course for free to them as a bonus.
okay, well, that's hey, do that. Yeah.
This way, it'll expand to more things that people can get CE credits for. Awesome. So right now, it's just for the things that are pre-approved. They're naturopathic doctor and genetics counselor, right?
Yes. Let me also
Okay.
say it's not like I just submitted a paper. This is a several month long process in order to get CEs approved. So it's not like, why don't you just do it for everyone? It's very difficult. So, but like I said, and if there's more interest, we were trying to figure out, what the bulk of the interest was. So if there's another profession that's like, hey, you know what, these don't qualify, we want something that will qualify. Maybe we'll go through the process of getting it certified.
I mean, we've got the case series, so people could find out more from there. But how do you go about using self-decode for somebody, right? Let's say they have X issue or whatever, they're trying to optimize some kind of health parameter. How do you go about using self-decode or what's your general process?
Absolutely. So, I think two things for any practitioner, no matter what profession you're doing. You want to figure out what's the main concern for this person. Why are they seeing me? You have to be very specific in figuring that out. That comes down to having a really thorough intake, and then when you see that individual, asking very specific questions. Um, because ultimately, that's why they're there, right? So that's part of your job. The other part of your job is when you're working with health information, if there's something serious and you come across it, it is now your job to deal with it. So whether that's within your scope, whether it means referring to somebody that has the scope to deal with it, um, that's the other part of it. So you have to consider both those things. How do you capture that information? So again, having a very thorough intake, and the intake is we'll touch on many different things. So my intake, we're looking at previous health history, family history, especially when you're looking at genetic information, we'll look at family history, current health history, whether they've had surgeries. Um, there's something called a review of systems. And so you could touch upon each organ system. So, for example, let's say they're coming to you for digestive issues. You could ask them, are you constipated? Do you have diarrhea? Do you have flatulence? And so you could ask these things. You could score it if you want to quantify how often or how severe these issues are for those people. So you look at all the symptoms that they may be experiencing. extensive dietary analysis. So there's many different ways to do that. There's tracking devices that we could use that people could send you that information. I like to at least do a 24-hour diet recall in a visit. This way, some people do not have that great of a recollection of what their diet's been like for the last several months, and so 24 hours is usually pretty good. Although oftentimes it happens to be atypical. It is what it is. Um, and just general dietary things. So, do they have dietary restrictions? Is there certain foods that they have to avoid? Do they have food allergies? That's another really important one. Food sensitivities, distinguishing the two. Um, Stress management, exercise, movement, activity. What does somebody do for a profession? Right? Are they sitting all day? Are they on their feet all day? And then you could look at the other types of environmental health things, right? Is there environmental exposures that we should be aware of? Is there like mold exposures or toxin exposures? Or they have a particular dental history? And so you could gather all that information to try to get a full picture of what's going on. So with that, so get all that information. What I'll do is I'll get that information. I'm figuring out from this whole thing what is the then most important things that I want to touch upon. Um, Self code is very large. There is a ton of information. There are a ton of genetic reports. People that have access to it ahead of time, usually what they're saying is, I don't know what to do with this. This is all these reports. I don't know where to go. I'm seeing smiley faces. I'm seeing sad faces. Like, how do I know what's relevant? And so when you have gone through the health history, and then you know what things you want to touch on, then you could go that angle. Labs is super important as well. And so what labs have been done? Sometimes they don't have labs, sometimes they do. The labs can vary. We have conventional labs that could just be a CBC, a CMP, and lipids, or it could be gut microbiome analysis, or full nutrient panel. There could be all sorts of things. So let me say, working at SelfDecode, I feel like I've seen almost everything. There's nothing that would surprise me at this point that I didn't think could be tested for. So there's a bunch of things to test for. Is it clinically relevant? That's a whole other discussion. But you could look at the information, make the determination. Is this something I want to include in my workup, or is it just extraneous information that's just going to lead us down a path? Which sometimes it does. People come in with their own idea of what they feel like is important and what they feel like is addressed. And your role as a practitioner is to balance that with what you think is relevant. You want to address their concerns, but you also want to address the ones that arise in you as well. And so, with that
So quick
information,
questions, a few
yeah,
quick questions. Number one is, are you using the intake form that we provide in SelfDecode for the practitioner accounts?
yes, those same questions, yeah,
Okay. Those same, but I'm saying that the software that you create questions and you send that to the patients.
yes, we use in self-decode. Yep,
Okay. And how do you find that? You could be honest, by the way. Just I'm just
yeah.
curious.
If you go to the, so I'll be honest, so I do have somebody else from self-decode helping me. Thank you, Jason. But so that will get sent. So you can put the person's email in there, and it'll get sent to them. Um, They send it, they answer it, and then you will get an email notification, and it will say, "Hey, so and so has filled out your intake." So then you go click on that, and then you will see their answers to your questions, and
So
you
did
could create whatever.
Jason helped you input the questions? Is that what it was? You gave him like a PDF, like a doc, and
Yes,
he put them in.
he will
Okay.
also send that to them. Just one less step I have to do. So I'll get
Oh,
the
okay. But
notification
that
first.
takes that's a short amount of time. Just it's a
Yeah,
click of a
no, it's
button though. Yeah.
yeah, it's not a big issue. I will say
Okay.
it will take time for you to figure out because there are many questions, right? You could have many different. That's why I hesitated because we actually have two questionnaires. We have a questionnaire that's just for the disease consults, which is going to be different. We found that if somebody's just doing the disease consults, it gets overwhelming for
Mhm.
them to do that and the nutrition and everything. So now we have a couple
So
different intakes. Let me say this. These questions that I ask on the form, it's one thing reading people's responses. I also like to hear their responses because how they give a
mhm,
response will also dictate how much I want to pay attention to it, right? They could sit there,
okay.
it's on the form, it says, do you have consumed junk food? And they might just say yes. But when you ask them, they're like, yes, I had some ice cream last night or something. And it's like, oh, okay. So I would say the form should not be an end all be all. It should be a prompt for what questions you should ask when you see them in person.
Right. Okay. And So, do you make them upload the labs to the lab analyzer?
Now that we have the practitioner sharing feature, yes, whatever labs they have had done, I'll be able to get access to before a visit. So yes, it's there in SelfDecode. Yep.
Okay. How do you find the feature?
I think it's really good. So the tracking over time, I think, is invaluable. I had somebody last month that had been tracking since the year 1999. So we saw
Interesting.
just this like 25, 24 years of information. And I was just like, oh my God. That's something otherwise, how many, how many, you'd have a stack this high of all the labs from that long. So,
Right.
especially tracking over time, it's invaluable. Also, when you're going over these lab markers, obviously I've seen these markers a lot of times. Some people will get lab markers, they don't know the information. So being able to click into a lab marker and go through it is really awesome because I could read to them in real time what it is, what the risk of it is, what things
Mhm.
we could possibly do for it. So yeah, there's a lot of
Nice.
just from the labs tab itself that we could get access to.
So you use that a lot and you find it's very, valuable to your consulting?
Yeah, I mean, and not just myself, the people that I have seen have found it very valuable as well.
The people that you're coaching?
Yes. Yep.
Okay. And by the way, we're adding a lot more recommendations to the labs, just FYI. I mean,
That would be
there's
awesome.
yeah, there's a lot of I mean, some of them have a lot of recommendations, but some of them are missing, but now we're adding them to all of them. Like, we also are populating, the database for the recommendations. This is a thing that I'm using all the time now, and I'm curious if you're using this recommendations feature.
I heard you talking about this before. Uh, I always go on the recommendations from specific genetic reports. I have not gone to this tab, but I'm curious. So how will you typically use this?
So, I mean, I guess there's, 2 ways to use it. First of all, we did add a lot of, recommendations to the report. So, let's kind of talk about, uh, a specific example, specific case. What would we I guess we could go to me, right? So this is something that I'm interested in, low mood,
Okay.
and what I really like is we added a lot of recommendations. So this one's going to have 53 recommendations. I go to the low mood report. All the recommendations are laid out there. And you can click on each one or you can add them to your regimen. So that's what I kind of do. I'll go to the main issues that I'm looking at or for somebody else and I'll just add them to the regimen and then they'll be on their care plan.
Gotcha. Yeah, that's typically well, I won't add it from there. Usually I'll scroll down and like discuss it with them, but essentially yes. So usually from the
Right,
report,
right.
I'll actually add it. Yep.
But
And
I'm
that's a
I'm saying
ton
if yeah,
of
if they're
recommendations.
interested. Sorry? Yeah.
That's a ton of recommendations there. It's a lot larger. It's been definitely growing since I've been here.
Yeah, yeah, the recommendations database has been growing a lot, and so, if there's a specific problem, I'll go here. Um, you could also go here, let's say if it's more general, for example, if, they wanna look at brain or something like that. It's gonna give a lot of recommendations. Now this feature is going through, is going through a bunch of updates. One is gonna be in a few days, actually. So by the time this is out, that'll have the feature, but you can see, let's say this is for brain. You can, pick a category. You can also pick multiple, I think. Yeah. 2 categories or 1. And it'll show you all the recommendations and, um, and then you could see what each recommendation is doing essentially. And you could also do, sort it by supplements. Let's say if somebody's supplement junkie like me and when they already do all the main stuff, you could see like all these recommendations. So, for example, pycnogenol, interesting stuff. So, I've got all these genetic predispositions that are high risk, and I used to have hemorrhoids, so I know that one was expressing. And every so often they come back. So, pycnogenol is probably um, something I should add to my regimen here. I mean, I have things that are similar, so like grapeseed extract, but actually I'm gonna probably put in the pycnogenol. But anyway, my mom has varicose veins, so that's genetic. It's more common in women. Um, I'm not gonna be getting Parkinson's for a while, but it seems like I have this genetic predisposition, and then my executive function in certain ways is a little poor, so that's good to know that this is good for it. And if I don't eat well, my blood pressure does go up. So this is kind of like counteracting all the negative genetic predispositions, whether they're expressing or not at the current moment. These kinds of processes, disease processes in the body, is going to be significant, and this counteracts that. So number one is it's cool to finding recommendations, just like if you're like, okay, what are we going to do for this patient or client? They've got some kind of brain issue. You could scroll through some of this stuff. Um, 5-HTP. Let's see, 5-HTP. I use this. This is like instrumental for my mood. So something
Yeah,
zinc
sound
is
very big
is
on that as well.
instrumental for a whole bunch of things for me as well. But you could see all the things that zinc helps with: acne, homocysteine, mood, predisposition to have lower zinc. But another way I use it actually is every supplement I think of taking. Like, give me a random supplement.
Let's go CoQ10.
Okay, so let's say we do CoQ10. We might have to do CoQ10 here. Okay, coenzyme Q10. So let's say you're thinking, okay, I'm thinking, you found it in a specific report, let's say, like, I have this problem, I want to prevent cardiovascular disease. Let's say, okay, you look at the report, you can add it from there. But let's say you say, okay, I want to see what more things that coenzyme Q10 could help with this person. You could look at, you could look it up here, and you could see that it's counteracting a lab result that's out of the optimal range. So for me, I have high lipoprotein A. It's about 50. It fluctuates, but coenzyme Q10 is one of the things that can bring it down potentially. And then there's genetic predispositions, hearing loss, Parkinson's, high blood pressure. So here's all the things that it could benefit that I have high risk for. Here's things that it could benefit that I don't have a high risk for, but still these are benefits. And typically, to get here, it needs a clinical trial, double blind, placebo controlled clinical trial. Um, and so you see, like, here's a whole bunch of examples: sperm motility. Chronic fatigue is just also another word for energy. So when I look at that report, actually, everything good for chronic fatigue also is good for just energy. So people want to know, how do I get more energy? I don't necessarily have more higher risk for this, but it's good to know that it helps with that. And, just a bunch of different things like skin elasticity, facial wrinkles, heart health, kidney health, things that I don't have risk for per se. High blood sugar, like, I don't have a risk for high blood sugar, but I do want to bring my blood sugar down. So it's good to know that the same with cholesterol. It's good to know that it helps with these things. So that's kind of how I use this feature. Like, I'll put in a recommendation, and other times I'll just put in a category. And you could also, some people are more interested in just in diet. Some people in supplements, and we've been adding a lot more granular lifestyle recommendations because that's what people want. Like, they don't want to know just, okay, exercise is good for this. They want to know, is it high intensity exercise, strength training, this, that, and the other. So we've been a lot more granular with all that stuff.
Awesome. So I'll tell you, I frequently run into situations where somebody is on a ton of different supplements. We all have reasons for taking supplements, right? This benefits from this one, benefits from that one. And
Right.
so when we're trying to prioritize, okay, which supplements do we want you to stay on and which ones are less important? If by using this feature, we could see, okay, based on your genetics, you actually should be more inclined to take this one because it hits more genetic issues versus another one.
It's what it's finding is all the clinical trials, and then we're matching it also against the risks. So as we get more risks and we get more recommendations, the database is going to get better and the algorithm is going to get better. So what we're doing is we're going to give a grade to each recommendation so that it you could see is this A, B, C, D, whatever. Um, and we're making it a lot smarter. So there's a lot of good improvements for this feature, but just right now for the prototype, it actually is still really good in the sense that I'm using it all the time because I've got a lot of labs uploaded here, and you could see, for example, how is omega-3 helping with my labs, right? Suboptimal apolipoprotein B, suboptimal EGFR. So the system also gets smarter the more labs you upload, which is pretty cool. Tell me exactly how you've been using SelfDecode now. And by the way, did you like when we put all the recommendations on like one page so you could see them all clearly? Or
Yes, I actually had a practitioner that, we were walking through that the other day, and, yes, and that was one question they had too, which it looks like it in on the screen that you just showed previously. They wanted specifically to have the labs as an option to also recommend supplements. And I don't know if that was an option before, but now it is clearly,
what do you mean
which
the
is nice.
labs?
Like, it looks like they were recommending supplements based on the lab values also, rather than just the genetic reports. And I think whatever big
That's
screen we were,
correct. It is.
yeah,
Right.
yeah. So,
And that's what they wanted?
yes, they did. So yeah,
Mhm.
basically you
Okay.
now have what they had wanted. And this was a couple
Okay.
months ago. So yeah, asking you to
Got it.
shower sleep, I
Okay.
guess.
Also,
Um,
yeah, do you look at let's say the lab results that should be tested for each of these? Like for each report?
on the reports that, yeah, I mean, you'll see this especially for the disease reports. And yes, we will go over that. Um,
Mhm.
so yes, we'll cover that. And,
Yeah,
yeah,
that's
so, really, I'll focus on going through genetic reports. So, well, genetic reports, I'll also go over, depending on if there's a particular gene of interest in one of the genetic reports, we'll go over. If there's a SNP of interest, we could go down to that level if we want. If there's a blog report written on that particular gene or SNP, we'll go over that.
mhm.
And then it depends on what other information they have. Like sometimes people have filled out the lifestyle questionnaire. So if there's that information we could look over. Obviously labs, it just, depends on did they upload it? And if so, what do they have in there? That's another thing too. I was going to mention, like whether it be the supplements or whether, it's a lifestyle analyzer. I mean, they're just basically trying to, it's time competition. And so what are they going to prioritize
Right.
their time to do, whether it's add supplements to a list or, fill out a lifestyle analyzer. But I will say, I feel like there's the people who take the time and dive into it. I mean, there's a clear difference. When I see people and they have dived through self Dakota, it's definitely a big difference compared to people who have not looked through it at all. And they see me and they want me to untangle it. A lot of the discussion is just, what is it? What do you have at your disposal? What type of information you have?
Mhm.
And so, as you were just showing a slice of what South Dakota has to offer, and even that it takes time to go through that. So, um,
So
yeah,
you'll look at a report, and so let's say, give me an example of a client,
let's
I
go
don't
let's
know.
go to LDL or cholesterol or one of those things.
Okay. Do a lot of clients have issues with their cholesterol?
Yes, I would say it's probably one of the most common things.
Interesting, and they want to address it for longevity purposes and things like that?
Yeah, sometimes their doctors recommended a statin, or they're just concerned that they have these markers. I mean, I feel like it's one of the most common atypical markers will be either elevated cholesterol or LDL or low HDL or one of those,
Mhm.
some combination of those. And so, and yeah, that's what they're trying to figure out is what can they do to try to bring this down. Usually, they've already tried some semblance of something, some supplement or something, and so now they're wondering what does Opticode say I should try in order to lower it?
Okay.
And so, and then with
So we'll
that, so
go
yeah,
here.
that
You'll
makes
go to recommendations.
yep. And so, now,
We got 81
we see
recommendations.
this big list, so I don't go from there, but usually I'll scroll down the list And then as we touch upon each thing, it's an opportunity for discussion, right? So number one, choose healthy fats. And so as I scroll down, we'll look at, and usually I'll see if there's a gene that's listed there. Um, Maybe we have one. Let's see.
Yeah.
Yeah, we do. So we have this one, PPARA. So, that's an opportunity for them. Now, and honestly, some people want that information. Some people want to know, what is this gene? What does it do? What's the variant? What other things can I do? Right. That's what's nice about SelfDecode is if you click that, there's other blog reports that could dive further into that one single gene if you wanted. And so, to
Mhm.
some people, I go to that level of depth, but not
Some
everyone
people
wants.
want that level. Interesting.
Yeah. Yep. Absolutely.
Okay.
But some people don't. I mean, if you have seen this before, so I'll say for the people that have gone through self decode, they've seen this report. They've looked through the report and now they're just wondering what more can I add or what other perspectives I have on it. For somebody that has not seen this, it's not helpful for me to go to a report, then to a gene and to a SNP because then you're overwhelmed, right? It's a lot of
Right.
information. So, so going through it step by step, you
So
see
you're
there
gonna
the
go
impact
through one recommendation one at a time.
if it's relevant, right? So, for example, sometimes you'll see smoking come up, right? The person's not a smoker. Are you smoking? No. Okay, move on.
Right.
Um, you know, have you
Choose
tried
healthy
this?
fats, like, okay,
Right,
what kind of fats are you eating in your diet?
right. And I will have
And then
already had that discussion with them, right? We will have already went through their diet. What are you eating? What types of fats? Maybe they have labs. We'll have already went over it. So when we get to this section, it's usually just well, we've discussed this. We know that you should probably increase your omega 3s, decrease your omega 6s to improve your omega 3 to 6 ratio, some semblance of that. So usually when we get to this, it's not like, what is this? We've never talked about this.
right. Do you find, that you think more like, let's say, if we're deciding, do we want more of these personalized genes or do we want more reports, let's say? What do you think, or more recommendations or whatever, right? Like, what do you think is, more useful?
If I'm being selfish, I'll say I want more of the gene recommendations. If I'm
Personalized to your genes?
yes. But if I'm
Okay.
not, I'd say honestly, it's a coin flip. I feel like half the people would like that, and then half the people would just like more reports.
Mhm. Okay.
Let me also say one big question I ask is, will saturated fats increase my LDL? And so that's where these genetic reports really come into handy, is because right there you see you have one variant, and there's several of them. As you scroll down, you'll probably
Right.
come across a couple more that are also associated, like ApoC3, and there's another one. So we'll go over that. There's
Yeah.
also the whole dietary section as well, right? People just wonder, what kind of diet should I eat? And so you have that whole section, just like proteins, carbs, fats in general.
Okay, so you go through one at a time and then you click on these things to add it to their regimen,
Yeah.
things that are
So, and
relevant?
it really comes down to, have you tried some of this, right? The foundational stuff, diet and exercise, super important. If that's not established, I usually spend a lot of time doing that. As after
Right.
we've kind of emphasized how important that is, then we'll transition to the supplements. You saw there, berberine was on there, garlic was on there, citrus bergamot I really like. So we'll kind of go through those ones first, and then we'll kind of work down the list and see what things have you tried, what other things should we add, um, and kind of work through there.
Mhm.
So
Okay. And then you go through all the different issues that they wanna solve.
yes. So, I will say honestly, I probably get through maybe because this is a lot of information, right? So by the time we get to it, maybe 3 reports per visit, maybe two. Um,
Okay.
if somebody is very new to this, I should take a step back. Because we kind of jump through it. The very first page of this is explaining like, what is genetics, what is this report, what is a polygenic risk score. So I want to make sure that they understand this. So I let them know. So this says based on
1,000,000.
1,366,051 genetic variants. So I let them know that's the variants they looked at. In this table, we have the gene on the left, ApoE, we have the SNP. And then I let them know, sometimes we know a lot of information about these, so we could click on them. Sometimes ApoE is one most people have heard of. So sometimes we'll spend some time on that. Let them know ApoE is associated with cholesterol metabolism. There's another key piece of information there. So go back real quick. Okay. Up to 65% of the difference in cholesterol levels is attributable to genetics. So I let people know that because some people wonder, how much are genetics to play a role in whatever health issue? So I always make a point
Right.
to emphasize that because it's important for them to know that yes, a good portion is genetic, in this case, 65%, but otherwise 35% is up to your choosing. It's things that you do in your life or supplements or diet, many other things.
Yeah. So, for example, it is very important to know. For example, if you're like, let's say, high risk on something that is only 10% genetics, then it's not going to be relevant. It's like, okay, you're high
Right.
risk for something in your genetics that is not very genetic, or that genetics can't explain very much of it. So you're not going to pay that much attention to it. In this case, actually, cholesterol, there is a big genetic role in cholesterol, which is why if you have high cholesterol, it's hard to just bring it down with diet and
Yeah.
lifestyle.
And the other one you kind of touched upon earlier, lipoprotein A. That's probably the one that is the highest genetic correlation. So that one, I could be wrong, but I feel like it's close to 80, 90% of differences in LPA is genetic. So, sometimes we get to those situations where something is highly genetic, but even in those situations, there's still some things that are recommended that could be potentially helpful. Like you were mentioning the CoQ10.
Okay, so you look through their reports, and then what do you do?
Um, Usually it's give and take discussion on what kind of things we're going to try. So, and that's where again, knowing what they have tried in the past, what do they feel like has worked, what hasn't, what can we what information are we using to support that it hasn't? Is it subjective? Is it objective? Is it laboratory information? And so figuring that out and then trying things. And not as cut and dry as as we've seen. There's a lot of genetic variation between each individual, and not the same thing works for every people. And for some people, some things work better. Um, so yes, trying different things. Also, again, a lot of it. I'm a big fan of information collection, and I'm a big fan of. So we have the genetic information, we have the health history, we have subjective information, which is basically symptoms, and then labs. And so uh, if one of those is we don't have that full picture, I always try to figure out, okay, how can we do this? If you haven't had labs done in a while, maybe you should get labs done. How do we get labs? What labs would be most appropriate? We could use the genetic reports or so that's another thing too. Like we do have blood markers, polygenic risk
Right.
score blood markers we could look at. So maybe there's some things you're like
So are you
AL.
looking at risks and seeing
Yep.
what?
I will sort by the risk, honestly, to start, because I feel like uh now after the health history, because not every risk is relevant, right? Maybe somebody has an increased need for zinc, but they don't actually have low zinc, or they eat enough zinc foods, or they tested their blood zinc and it was normal, right? So I look at
Right.
of the things that they have a risk, where is the risk manifesting, right? So let's say
Mhm.
homocysteine. Let's say they measure their homocysteine and it's high, which I will say that I feel like that one is very accurate. Usually when I see that one higher homocysteine, they have some semblance of higher homocysteine. And so we'll then focus on that. What causes higher homocysteine? Why does that say you have a higher genetic risk of homocysteine levels? If you haven't had it measured, measure it. Um, do they have risk of cardiovascular issues as well? Because that's how high homocysteine would be increasing risk is cardiovascular disease. So,
Right.
um, so yeah, go
So
through
you're
all
gonna
that.
look through these risks and see. So this is one of the processes you do. You look at the risks.
Yes. Now I don't just of which is relevant. Like at this point, I know which reports I'm looking for pretty precisely.
Mhm.
Rarely does somebody come in without some issue or some angle a couple times. And in those situations, I will just basically almost blindly sort by risk. Okay, all your labs are normal. Your health is fine. You have zero symptoms. Okay, what now? Let's just look at your genetics and see, well, based on your genetics, what are you predisposed to? If that's in younger individual, then maybe when they're older, some of these other genetic risks will then manifest. So now we're looking at
Right.
having a preventative action towards preventing the onset of some of these things like kidney stones or homocysteine or whatnot.
Okay. Most of the time, people they come in, they would know what they want to optimize.
Usually they know the health issue. Usually they're on this path because there's something that they know that they need to work on or address. Sleep and stress are
Okay.
probably the two most common ones. Sleep, stress, and cholesterol, I feel like are the three biggest ones.
Is there anything else practitioners should know?
People want something specific addressed. And that's where the health reports are helpful. Now, and in some cases, people there's something else that needs to be addressed, and so maybe it's not their direct situation or condition, but usually we're addressing something specific. Usually, sometimes the recommendations are general,
Right.
but that's why I mentioned the supplement optimization thing. Sometimes it's not a health issue they have; their issue is just they have too many supplements. They want to figure out what should I stay on, what should I stop,
Mm.
and so we could use SelfDecode for that.
67% of listeners aren't subscribed to the show, so please don't forget to show your support by hitting the subscribe button now. You'll not only be supporting the show, but also investing in yourself and your health journey, all while helping to keep us ad free.